Welcome to YouTooSpain Live. That was a bit of a spooky introduction countdown, wasn't it? I've not used that one before. Anyway, this week I'll be welcoming an expert guest to answer all of your questions about what healthcare cover you need for your Spanish visa and residency. Join us on the live chat or in the comments below because you are a part of this too. That's what this channel is all about. You're welcome to YouTooSpain. Run the theme music. Let's dance. That's groovy. And speaking of groovy, let's meet my guest for today. It's Ciaran O'Toole from Innoinsure. Good morning, Ciaran.
Good morning, Skatz. How are you? Thanks for having me on the show.
Oh, you're very welcome. I'm very well, thanks. And you're based in Madrid, aren't you? What's it like up there at the moment?
Well, funny enough, after a summer of probably 35, 40 degrees, it's been cool. It's dropped to about 30 degrees and it's been raining all night and yesterday. So bit of a nice change. I never thought I'd be so happy to see the rain, but it's normally nice, but today it's a little bit different, but all good.
Yeah, that must be a relief. I know it's like that down here. We've had the last week. It's sunny out there now. The sun's come out from behind the mountain, so we're going to have a good day. There's a bit of a mist on the coast on the south there. I think the sands have come over from the Sahara again. But
Yeah.
there you go. That's a regular thing down here. So it's been nearly 2 years since we had you on this show. I can't believe it. Doesn't feel like that long, does it?
Yeah, well, time certainly flies. I feel like, a lot of people are saying that recently, especially when you're living in Spain. Just life's so good, so time does really fly by. So it's really good to be back, and I really appreciate you having me on the show, and I'm looking forward to it.
You're completely welcome. Do you know that the when there was votes about the nicest customer service voices to hear on across the world or across the UK and Ireland, and the Irish voice came up as the number one. So there we go. A lot of
Yeah,
people smiling in the background now.
great to hear. Yeah, I'm very happy with that. Starting it off with a compliment.
Brilliant. I'll just say good morning to a few people on the live chat. There's only one or two people commented so far, and one of those is Yogi. Yogi, we're going to have Yogi on the show in a couple of weeks' time, I think it is. Yeah, 2 Saturdays' time. And yes, thanks, Yogi. I'm doing well. And good morning, Todos from Anton Kez. It's wet and stormy and 20 degrees Celsius here. They're in France, so I
Oh,
think
wow.
halfway up France.
Yeah.
And there you go. So we'll say hello to everybody else as they join us. They gradually come up. And yes, if you joined us and you haven't said hello yet, say hello in the live chat, then I can wave back to you. So just before we get into the questions, I did promise everyone on a little preview, I did an update on the S1, which is very relevant to today's topic. Now, it's been known since Brexit that if you're a retired UK resident of Spain through the withdrawal agreement, you could access not only free healthcare in Spain because of the S1, you could continue to use the NHS in the UK for free for everything, the whole service. So that was handy for people who, maybe had visited the UK and then got sick and had to go in for treatment and had to stay there for quite a bit. It was good to know. But the big news is, and we've just been made aware of this via a beta tested website called NHS Business Services, which is going to be a big thing. They're going to be running, I think, all of the online stuff for the NHS. And that is since the beginning of this year, 2024, residents with an S1 who arrived after Brexit can now also use the NHS for free too when they're going back to visit, which is excellent news for quite a number of people. Excuse me. So if you know someone who could benefit from that, do share that news on. I have put a link in the video description below which officially confirms what I've just said, with that business services link, and there's also a link in there to contact the NHS overseas team who will confirm that this is all official information, even though it's not on the British government UK website. It is proper and real. We've been checking up on that. So there you go. And good morning to Mike Ripper. And he's not going to be far behind Robbo, who has arrived only a week ago. That's brilliant. And Thomas Williams says good morning to both of us. Thanks for the good info. And that's Tom and Josie. And Aideen Ward. Good morning, Aideen. We have your question all about health insurance, and actually we're going to cover that in one of the questions that I have. So listen out for that. It's all about having a pre-existing condition, which I'm sure we'll get to very soon. Okay, so that's that for now. We're here to talk about private healthcare today, so let's get straight into the questions. First of all, then, this is an important one. Do you work for one healthcare insurance company, which limits what you do, or are you a broker, which doesn't? Tell us the difference.
Yeah, that's a great question, Scott. So we work for Innoinsure. So Innoinsure is an alliance of official international offices of the leading health insurance companies in Spain. So we represent a few private health insurance companies in Spain. Typically, so we're similar to a broker. Typically, a broker will represent a couple of different policies or companies, whereas an agent will work for one health insurance company. So we have different policies available of the biggest health insurance companies in Spain.
Brilliant. So who actually needs healthcare insurance in Spain and who qualifies?
Yeah, really important. So people come into Spain on a visa, such as the non-lucrative visa, golden visa, digital nomad visa, student visa, or if you're coming as a resident, typically you'll need private health insurance that meets the visa and residency requirements. So anyone can qualify for that. It's a requirement when you move into Spain. Typically, you don't need, it's not required to have private health insurance if you're working here in Spain and you're contributing to the Spanish social security system. In that way, you'll have access to the Spanish public healthcare system. If not, you're coming on a visa or on a residency permit, you'll need Spanish private health insurance. And most importantly, it must meet the visa and residency requirements.
Okay, and I'm sure we'll come to the question about how it meets the requirements in a minute.
Yeah.
Just a little question from Robbo about the NHS there from the news item. Can you still use the NHS back in the UK if you're not on the S1, as you don't qualify for S1 because you're not of pensionable age? So you're 58. You're younger than me, Robbo. I didn't know that. No, you can't. Officially, you can't. You can use the emergency services, but once you're in Spain and a resident, then you're not supposed to be using the NHS services. But what you can do is get the equivalent of the GHIC card in Spain, which I can't remember the name of now. There's another abbreviation, so that you can use health services in other countries. There we go. Hope that answers that question. And Robbo said earlier, thanks very much to me and Chris for all of the help in getting him through all of the difficulties. And I've also asked him whether he wants to be on the show to go through all of the difficulties he's had, which will help everybody who's moving, I think, to understand what you can come up against. And also E9 Hug is saying thank you to Chris and this channel for getting us through the long, frustrating wait. That's Stephen Pam. He also gives an update that it took 7 weeks for the non-lucrative visa to arrive, and they applied through Manchester, and they fly out Monday week to Matheron in Murcia with the S1s. And I'll give a plug to Sean from Expat in Matheron. That's his Facebook group. That's good fun. I'm sure you'll get to meet him. I think he's in Campus Hall 2 or something like that. So look out for that YouTube site. There we go. So, as well as private healthcare, can't you get healthcare for free?
Yeah, so as I mentioned, if you're contributing to the Spanish social security system, for example, if you're working here for a Spanish company and you're paying Spanish taxes, you're contributing to the Spanish social security system. So in that case, you have access to the Spanish national healthcare system, which similar to the NHS in the UK, here in Spain, the public healthcare system. you have access to that once you're paying and contributing to the social security system. If not, like majority of people coming to Spain from the UK or Canada or the US, any countries, you'll be required to have the Spanish private health insurance. Of course, as Skatz mentioned as well, if you have access to the S1, then you don't require private health insurance. But if not, you'll need Spanish private health insurance. And as I mentioned, you must meet the visa requirements.
Great stuff. There is also the, what's it called? Convenio Especial, which you can get after a year.
1 year,
But,
yeah.
but it takes a while to apply for, so
Yeah.
you still have to get year two's private insurance anyway.
Yeah.
Yeah, it can take a few months, during which time you wouldn't be covered. Mike Ripper's saying the equivalent to the GHIC is the tarjeta, let's put this on the screen, Tarjeta Sanitaria Europea, the TSA. I think that's perfect. Thanks for that. Yogi says, Sean from Expat and Macedon is on Campus Alt A. Thanks for that, Yogi. You've been up there a bit, haven't you? Excellent. So I mentioned healthcare insurance and travel insurance. So what's the difference between those two? And do you still need, I've already said this, do you still need travel insurance when you first arrive in Spain on a visa, for example?
Yeah, so health insurance covers a longer duration. For example, it'll cover your first year on a non-lucrative visa. Or if you're coming to Spain and you're studying for 9 months, you'll need health insurance because it's a longer period. Travel insurance is different to health insurance because typically it'll only cover emergencies and it's capped at maybe 3 months. So if you're visiting Spain on a 3-month or 2-month holiday or a trip, you'll most likely go for travel insurance and that will cover your travels. Although if you're moving to Spain long term on a visa, you'll need health insurance. Really important to note as well, travel insurance doesn't meet the visa requirements or residency requirements. So travel insurance mainly for a short-term trip of 3 months and less, and then health insurance will cover your longer stay in Spain. So that's the main difference between health and travel insurance.
Brilliant. That's very clear. And I did mention earlier that it does take a little while to set up once you've got your TIE and taken it to the health centre and done all the forms. So it's good to be covered during that first initial period.
Yeah.
There we go. So if everyone on a visa needs healthcare insurance as part of their application, is there anything that stops people getting cover? And this comes down to Aideen Ward's question about having, she says, does it cover my husband's mild heart problem for our NLV? Are there any policies which do this? Do you know? So pre-existing conditions, tell us about those.
Yeah, that's a brilliant question. That's a question we get asked a lot. Regarding what can make it difficult to obtain health insurance is unfortunately age can have an impact or make it more difficult, and then pre-existing conditions as well. Although with us, we'll request 4 or 5 questions on the pre-existing conditions, such as when was it diagnosed, the medications, any checkups. We'll then submit that to the medical review team of the health insurance company. They'll assess the pre-existing condition, and of course it's done on a case-by-case basis by the medical review team of the health insurance company. And then once confirmed, they'll provide us with the quote, and then if confirmed by the medical review team, the pre-existing condition will be covered and included. So that means consultations, checkups, tests, they'll all be covered and included. You can visit a doctor directly and that'll be covered and included. And then more high-tech examinations, they'll need authorization by the health insurance company, but it's done on a case-by-case basis. We do insure people with pre-existing conditions. We'll submit it to the medical review team. They'll provide the quote and the information, and then we'll send that back to you. And then if successful, the pre-existing condition will be covered and included, which is really important because many people moving to Spain from their home country want to have clarity on their pre-existing condition. So that's a really important one.
Yes, indeed it is. Just to say hello to Craig Halliday for joining us, and Upsticks, Chris from Upsticks. Morning, Chris. And who else did I see on there? Duncan Burdorf. We are going rollover in Spain for at least 7 months, but have secured EU passports. There you go. Congratulations. We're going to live in Spain, he says. Do we need to get insurance if you're living in Spain as a resident, and you register as a resident? Then yes. But I guess if you don't, then travel insurance. But I don't know. What do you recommend there, Ciaran?
Yeah, in that case, so when you're an EU citizen, such as myself, so I was an EU citizen, I moved to Spain, and you have to register with the national police. And some of the requirements, now it depends case by case. Different people have different requirements. For example, if you're working in Spain and you're contributing to the social security system, you'll have access to the public healthcare system, which is great. If not, such as an EU citizen retiring in Spain, you may need private health insurance for your residency application. So when you're going to the police station to get your NIE green card, you'll need private health insurance that meets the residency requirement. So it's important to check your case. But typically if you're not working, you're retiring in Spain, you'll need private health insurance.
There you go. Now, officially, if you're going to be living there for more than 3 months, you're supposed to register as a resident. There's quite a few EU citizens don't, though. I don't know whether I should definitely not be recommending it, but for the sake of, if you're going to be travelling around all of the time, which a lot of people do as as EU residents, because you can, then it's a lot of paperwork to go through just to move out again in 7 months. So there you go. But of course, if you're living there for over 6 months in one calendar year, you'd have to register as a tax resident. So just be careful about that. It's good idea to be careful. So can anyone be refused cover completely for any reason?
Yeah, that's another important question. In very rare cases, as I mentioned, if there's a pre-existing condition, no matter if it's very serious or maybe quite mild, it'll be submitted to the medical review team. And there are rare cases, it does happen, but not very often, that the medical review team will reject the application. So having a pre-existing condition, unfortunately, in some cases, it may stop you from getting cover, unfortunately. And as I mentioned earlier, age may have an impact as well, but it's always done on a kind of case-by-case basis.
Mm-hmm. Is that, sorry, I don't know if I heard properly, is that by the insurance company or by the consulate?
That's from the insurance company. So the insurance company, the medical review team, they'll assess the condition, and then they'll provide the results. So it's just done by a case-by-case basis. Yeah.
So it's a good idea, if you've got the serious pre-existing condition, to sort this out beforehand. Just even if you don't buy the insurance immediately, but get that done before you pay for your visa at the BLS office.
Exactly.
So, otherwise you'd be losing quite a lot of money there.
Yeah.
There you go. There's a question from Mike Ripper. This is an interesting one. I've not had this before. Why can't the insurance company see a customer's NHS health records with the customer's permission, of course? It's very easy to not know all of the technical aspects of a medical condition you may have had.
Yeah, that's actually a really good question, Mike. So as I mentioned, if someone comes to us looking for a quote and they have a pre-existing condition, we'll ask for the information. So it's about 4 or 5 questions with the details. And then if you like and you have information on that condition or conditions, we can also submit that to the medical review team. So if you have a health record or a medical report on a certain condition, we can submit that to the medical review team, because in some cases, not often, but for a certain pre-existing condition, the medical review team may need more information or more details. But we'll always communicate that with you and submit that then to the medical review team. But it's always done on a case by case basis.
Great. Mike was talking about a long time in the past, possibly, and Jed is echoing that. The difficulty in applying for health insurance for us older people is that we tend to have a long medical history and can forget something which may invalidate the insurance, especially if the condition is memory loss. That's not going to help, is it? Yeah. Does it make any difference if it's a? I suppose it does. If it's a condition that was a long time in the past, it's going to be less of a problem than a condition that's a recent one.
Yeah, well, what we always ask, and it's really important, and that's for the customer as well, more importantly, that we ask for all relevant information and conditions, although it may be a bit of a pain in the backside, especially if it was such a long time ago, but we just ask for as much information as possible, because that will help you in the long run. We'll then submit that for the medical review. But we just always request that you submit as much information as you can and as accurate as possible, just so the insurance company the medical review team of the insurance company just has all the related and specific details. But I do understand if it was a really, really long time ago, may not remember details, but just give as much information as possible is kind of just what we ask for, and then we can submit that through.
Yeah, Mike was worried that the not got the medical knowledge to convey the full condition. You can get a hold of your medical records and submit them, I suppose, can't you?
Yeah, exactly. In that case, we ask for as much information as possible. Although, if as you said, if you don't have the medical knowledge, you can just submit a medical report on that condition, and we can submit that as well. But yeah, I understand that there may be a lot of information, but this is really important as well, because we want to be as clear as possible for the condition to be covered and included. So yeah, in that case, you can just submit the medical report and we can send that through.
There you go. He's worried about unwittingly misleading the insurance company. Had an operation over 20 years ago, which doesn't remember any details of, but it was successful. There's never been a problem since. Can't imagine that being a problem then.
Yeah, I can imagine that would be a problem. As I said, we just require as much information as possible, any medical details or pre-existing conditions, and then we'll submit that. But operations over 20 years ago may not have an issue, but that's completely up to the medical review team. And we're the commercial office, and we communicate with them just to give them as much information as possible for them to provide the review.
Brilliant. I hope that's fully answered that. Okay, I understand now. He says, thanks for the clarification. Great.
No problem. Really important questions there, so want to be as clear as possible.
Absolutely, and it is a worry for a lot of people. So yeah, hopefully that's cleared it up. Good. Can you choose when your cover starts, and what advice can you give us around that?
Yeah, so a bit of advice there. Sometimes people come with different information. So typically your appointment with the BLS or with one of the Spanish consulates in the UK, in the US, anywhere in the world, is going to be a couple of months before you move to Spain. And for your consulate, for your appointment, for your application, you'll require the insurance certificate and the terms and conditions document. So you'll need that 2 months before your appointment. So what we allow is you can have a future start date as long as it's on the 1st of the month. For example, if your appointment is in September 2024, but you're moving to Spain in December 2024, within 3 working days after purchase, you'll receive your insurance certificate and the terms and conditions document via email with a start date of the 1st of December. And why that is really good is you're not paying for Spanish healthcare for September, October, November, when you're not going to move to Spain until the 1st of December. So you can have a future start date just as long as it's the 1st of the month, and within 3 working days after purchase, we'll send you the insurance certificate and documents via email. So that's kind of important regarding the start date.
Yeah, so that's next question was how long should your insurance cover? Which I think you've more or less done that. But can the period of insurance be changed or cancelled or extended? I suppose this is to do with if you've booked your ferry or you've booked your flights to
Hmm.
move over here and you've done that quite far in advance and you haven't quite yet got your visa, then your insurance is going to start slightly before the 12 months, but you need it to be covered until absolutely the end of your first year, because otherwise you won't be covered on your visa, will you?
Yeah, exactly. So in that case, if you send us an email or reach out to us within 3 working days before your original start date, so if your start date was the 1st of December, and sometimes Spanish bureaucracy can be a little bit of a pain, and there's delays with the consulate or with appointments. If you contact us 3 working days before the original start date, we can have your insurance start date changed. So, for example, you notify us 3 working days before the 1st of December 2024, we can have your start date changed. For example, if you want to push it 1 month back, you want it to start on the 1st of January, or you want to pull it 1 month forward, just let us know 3 working days before the original start date, and we can change the start date for you, the coverage dates, and then we'll send you the updated insurance documents as well.
Great. And what about cancellation? Is how much of a lead time do you have on that?
Yeah, so with air in health insurance policies, you can only be cancelled and refunded if your visa is rejected or your residency permit is rejected. So if you, unfortunately, your visa or residency was rejected by the consulates, if you just send us an email or reach out to us with the letter of rejection, you'll be refunded. So we just need the letter of rejection. Contact us with that, and then your insurance will be cancelled and you'll be refunded.
Okay. And that's even if it's right up to the date of the start date of
Yeah,
the insurance. Yeah.
exactly. Yeah. So it's all unused months are refunded. So if your insurance hasn't started yet, all 12 months will be refunded. And then if you're 3, 4 months, which is very rare, because as I said, typically your health insurance will start when you arrive in Spain, and your appointment will be before that. All unused months are refunded in the case that you're in Spain a couple of months.
Great. JM says, am I right in thinking that if you have preconditions, then go for the S1? Well, if you can get the S1 as a retiree, then go for it. Get that anyway. You can also, while you're on the S1, you can actually get private healthcare insurance as well, if you can afford it on top of that, just to cover you, because there are times when you can get in and see a doctor quicker, or for to get treatment for something in particular. That's one of the things about private healthcare insurance, that it can be better than the
Yeah.
public. Although I've had pretty good. Once I was diagnosed with cancer, they got me in very, very quickly. I had to wait for the diagnosis quite a long time. But once they said, oh dear, right, we'd better get started, it was a matter of just a few weeks, bringing me in for all of the tests and everything. So there you go. And Mike Fisk says, good morning. And yes, good morning to you. And Paul Cook, good morning. Sorry, a bit late today. We'll have to catch up. And Mike Ripper says, report to my office after class, Cook. Very good. And oh yes, El Davido, good morning to you as well. And he's talking to Jed, and that happened to a mate of mine. He genuinely forgot he'd had a stent fitted. It was years and years ago, and they cancelled his policy on the spot. Oh dear.
Yeah, that's very 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 difficult situation. Unfortunately, fortunately, we haven't had that with any of our customers, where we've never cancelled anyone's policy on the spot for something like this. As I mentioned, just to the best of your knowledge, provide as much, just in general for any health insurance company, to provide as much insurance information as possible, just to avoid something like that happening. I know it can be difficult, but just take all the time you need to provide as much information as possible. But I've never heard of the insurance company cancelling the policy on the spot.
Okay. Mike Fish says, not sure if this point has been covered, but there is a new Spanish law that states forgive and forget rule for anyone that's had a previous health condition that is now clear for over 5 years. Have you heard about that?
No, but I must look into that. It would definitely be really nice for customers, as the previous viewer had commented. If that's applicable, then that's great. So we must look into that. That'd be really nice for clients over
Absolutely.
5 years. Wow, yeah, that would be great.
Yeah. El Davido says, forgot to say good morning. Yes, good morning. And,
Good morning. I love it.
Duncan Burdoff is saying, very informative. Thank you. That's good. Make sure you click on the like button. I've had a message across the screen earlier on. Yeah. So only click on it once, though, because if you click on it twice, it disappears. And also subscribe and click on the bell. Do that. And also on my Still Alive channel. That's my other YouTube channel. Don't forget to subscribe to that too. Jed Tierney says, a very important question. Does your insurance cover stress trying to get Oasis tickets in the UK? That should be on the policy, shouldn't it?
Yeah, I must speak to the team and see if we can cover that, because I know we'd have a lot more clients looking to cover that stress, for sure.
Yeah, it's all of the old people that can't get the tickets, because the young people are all getting them because they heard Wonderwall once and now they're going to see it. Now none of the rest of us can get tickets. That's the word that's going around anyway.
It's a pity.
Yeah. So come to more questions in a minute there, but when do you receive the documents once you've organised your policy?
Yeah, so once you purchase the insurance, within 3 working days via email, you'll receive the insurance certificate and the terms and conditions document, and they're all in Spanish as well, which is a question people would ask, because that's the requirement, that the health insurance documents are in Spanish for your appointment. So no need to translate. They're the official documents. They'll be sent to you via email. In the case that sometimes people are maybe leave it last minute or are in a bit of a rush, which is completely understandable, because a lot of documents are needed. If you need them sooner, just reach out to us and we can request that your documents are sent sooner than the 3 working days, and we can do that.
Excellent. El Davido says, from what I remember, they cancelled as they questioned, what have you not told us about? That's interesting. Wonder why that came up.
Yeah, no, I've never heard of that, but my advice would be, as I said, to as much information as possible to submit that.
Great. And Craig Halliday says, my wife will be eligible for S1 midway through our 2nd year of private health insurance. Do any companies do monthly policies, or is it, as I suspect, I'll have to pay for the year?
Yeah, well, unfortunately, in that situation, Craig, with us anyway, the health insurance, it must be paid up front for the year. We don't have monthly policies, especially when it's visa insurance, because typically the requirement is 12 months, because it's for example, the non-nuclear visa is a 1-year visa, and then for the renewals, 1 year, and then the 2nd and 3rd year, and then 4th and 5th year. But the health insurance must be paid up front for the year. So unfortunately, we don't have monthly policies, I'm afraid.
Yeah, there's no point, because the requirement of the renewal is that you have to have the full 12 months. So sorry about that, Craig.
Unfortunately.
Yeah, have to save up for that. And Jason's Web, good morning. Sorry I'm late. My dog ate my homework and I had to redo it. I love all these excuses.
Yeah.
Mike Ripper says, well, at least your old grandma hasn't died again. There you go. And good question from Mike. If one partner is over 66, can the other younger partner piggyback off the older one? You can on the S1. Can you on private policy? Well, you've got to have a separate policy, don't you, for each?
Yeah, exactly. It's a little bit different then in the S1, but in that case, as I mentioned, if you can piggyback, then that's great.
Great. Let's go on to deductibles. I've heard the word. What's it all about?
Yeah, so the deductible is a fee paid by the policyholder for a covered service before the insurance company starts to pay. So unfortunately, that's applicable to some policies, but with our health insurance policy, and typically health insurance policies for your visa, well, they shouldn't have deductibles because it's a visa and residency requirement that the health insurance has no deductibles. So in that case, it's not applicable, fortunately.
Okay, great. And there's also something called a waiting period. Does that mean your insurance doesn't start straight away?
Yeah, so the waiting period is the amount of time a policyholder must wait before some or all of their policy comes into effect. For example, your policy starts on the 1st of September, but there's a 6-month waiting period for certain services. And then same with deductibles. Air policies don't have waiting periods, and it's a consulate requirement of the health insurance and residency requirement that the insurance has no waiting periods.
Great. What about co-payments as well? That's a big word that some people said they were denied because of co-payments.
Yeah. So with a co-payment, it's a flat fee paid by a policyholder to the hospital or clinic for a covered service. As you mentioned there, the health insurance mustn't have co-payments. So really important to ensure your policy meets all of the requirements and has no waiting periods, no deductibles, no co-payments, and also includes repatriation as well. So just always ensure that the health insurance policy meets all of the requirements and has no co-payments, no waiting periods, no deductibles.
Right. That is good to know. And can you buy insurance if you currently live in Spain? I guess you have to if you're doing it for the renewal, certainly.
Yeah, you can purchase health insurance if you're in Spain, in the UK, in Australia, France, any country. You can purchase insurance, and air policy can be purchased 100% online as well. So it doesn't matter what country you're in, and if you're in Spain, you can purchase as well.
Great. Jason says, as I'm late, I may have missed this. No, you didn't. Does your company do life insurance for UK citizens living in Spain?
Yeah, hi Jason. Thanks for the question. Unfortunately, we don't do life insurance. It's just health insurance. We also have pet insurance, home insurance, accident insurance as well, but we don't have life insurance, unfortunately.
Yeah, that does tend to be separate companies. I think it's a whole other ball game, that one. I was going to try and get that as part of something else as well, but no, it's separate.
Yeah, okay, different companies do have the life insurance as well, so it is available. It's just our company doesn't offer that, unfortunately.
Right. Well, I do have more questions, but and I'm sure there'll be more on the live chat. But now it's time for a short break with your halftime reminder of all of the services available to you as a YouTooSpain follower. And while you're watching that, take a moment to subscribe. I'll keep using that word because some of you are joining us later on and haven't heard me say it yet. It's very quick, costs you nothing, and there's no obligation or anything like that. It's just a way to get notifications and tell you when the latest videos are on in case you don't see them when I share them on Facebook or whatever. Right then, lads, take it away. Tell us all you know. Are you getting the most out of YouTooSpain? I don't know. Did you know that apart from these Saturday morning live shows with expert guests or expats with really exciting stories to tell, it's like the Graham Norton show. Bah! There are videos every Wednesday evening, packed with all the information you need so we can move to Spain and enjoy living here without paying tax. No, Colonel, that's illegal. But you can find out how to navigate the bureaucracy successfully. Well said, Walter. How do I find the videos? Just subscribe to the YouTube channel, darling. And click on the bell, you useless Colonel. There's a playlist here called Video Diaries. Oh, now that is Skatz's thrilling personal story about his life and health in Spain. Still alive!
Live! Hashtag FOF. You can support YouTooSpain as well, my darlings, if you think you've learned something valuable, or if you've been entertained. Skatz looks like he needs your support. The poor bugger can't even stand up. If he was a horse, I'd shoot him. Colonel! He's not a very nice man.
It's all right. He's just a two-dimensional stereotype.
Aren't we all, sweetie? I'm not. Brexit! Moving on! So how do we support YouTooSpain? Use the QR code in the corner. Or there's a link in the video description below. I can't find it anywhere, darling. In the video description, you idiot!
I've warned you, Colonel. I'll send you back to the nunnery.
While you're watching or pausing, below the video, you'll see the title. Just here. Oh, I see it. Not far below that, there's a description of what the video is all about. It says, read more.
That's right. Just click or tap on that and lots more text appears.
What's the information all about?
There's contact information for the expert guests and lots of links to other related companies that I recommend. And they help out YouTooSpain if you use those links to get in touch with them.
There's so much down below. Does anyone have a pen?
No need, Tommy. You can find everything on our website.
YouTooSpain.com. And don't forget the Facebook page. And the YouTooSpain community group, where you can talk to other people like you. There's no one like me, sweetie. Thank goodness. Is that everything? There's a guest waiting to tell me things. Oh, I do like things. Where's Doogie Dog? That used to be his line. I'm stuck behind a wall.
Oh, sorry, Doogie. I'll come and find you after the show.
Thank you, Master. Get back to the show. I need to go and punch some servants. Oh, Colonel. Back to Skatz in the studio.
Thank you, lads. That was very informative. And sorry, Doogie Dog, still stuck behind that wall. It's been a long time now. I am going to re-record that middle section and update it because the Still Alive playlist is no longer on YouTooSpain. I started up the new channel, so yeah, and various other things. And I'm wearing winter clothes in that, and it still makes me feel hot. So I'll do a summer version, or an autumn version. There we go. Let's see. There's a question from Craig Halliday I've just noticed. Here we go. I have pre-existing conditions and need a prescription. I take it I would see a private doctor for the insurance company when I get to Spain, and he would prescribe them to me.
Yeah, that's exactly it, Craig. So you'll visit a doctor, for example, if you need medications for that pre-existing condition. You'll visit the doctor. He'll then prescribe you with the medication. You'll then go to the pharmacy, and then you'll pay for the medications. But that's basically how it works. Visit the doctor. He'll prescribe you the medications. You visit a pharmacy and then get the medications from the pharmacy then.
Yeah, it's a good idea to have enough of your prescription medicine in order to cover you for that first period when you're getting your medical card or whatever it is, or your insurance registered at the health centre. So
yeah,
that's a good one. And Craig says, any idea how long that is likely to take? That's a good question. It's all about how long it takes to get you. Do you need your TIE card to register at the health centre when you get there?
No. So once your policy starts, you'll have your digital card number. Then you can register with the insurance company on the app, and we can also send you the digital card while waiting for the physical card. And then you just go to a medical centre, a doctor, hospital within the health insurance company medical network. Visit the doctor with your ID and your either physical or digital card, and you'll be seeing. So once your policy starts and you have your card number, you can just go directly to the doctor and have that done. So once your policy starts, you have all the insurance card and your ID, and that's that. You visit the doctor then. So it doesn't take a long time, just once your policy starts.
Excellent. And Jed says, does Innoinsure offer policies which can omit certain conditions such as heart or lung disease in order to reduce the cost of the policy?
Yeah, that's a good question. Thanks for that, Jed. Unfortunately, with air policies, we can only cover and include the pre-existing conditions, so we're unable to exclude any conditions. Unfortunately, if, as you said, if you're looking to reduce the cost of the policy, unfortunately, we can't have any exclusions, I'm afraid.
Yeah, sorry about that. And Paulie Stirat says, good morning. Yes, good morning. It's the first time I've seen your name on a live chat. Welcome to YouTooSpain. Can you get cover for 15 months? I think we may have mentioned this earlier, but of course, some people are still arriving and just joining us at the moment. So we'll repeat that. Paulie says, I plan after a year to pay to access the Spanish health system, but want to ensure I am covered during the transition.
Yeah, we'd have to confirm with the health insurance company if you were paying for 1 year health insurance coverage, and then you wanted an additional 3 months. That wouldn't be possible. Although initially, if you were, because with their health insurance policy, the minimum is 12 months. Although if you're looking to purchase initially for 15 months, that may be possible. We just have to confirm with the health insurance company. So if you know in advance that you're going to then switch after 15 months, we could then confirm if it would be possible to purchase 15 months initially. And then we could let you know. So we just have to confirm with the health insurance company.
Great. Mike Ripper says prescriptions are not free in Spain for the over 60s, right? Generally, you pay for your prescription in some way. Are they expensive? Not in my experience. No, there are what do they call them? Upper limits on how much you're allowed to pay on for your medication. So even if you've got lots of medication, there's a kind of an upper limit on the prescription charges that you need to pay, which is a lot less than anywhere else I've heard. I'm guessing not, as Spanish old people seem to spend most of the day at the local pharmacy. They do like to chat. What's your experience of that?
Yeah, well, just on that. So with the health insurance policy, with their policies, medications or prescriptions aren't included, and they must be paid out of pocket. Which, from my experience, could be different. Typically, medications or prescriptions aren't included in the private health insurance policies. From my experience, someone else's experience could be very different. But from my experience, medications in Spain or prescriptions are cheaper than from my experience in Ireland anyway. They're cheaper, but in someone else's experience, they could be expensive, I suppose. And then, yeah, I do see some people, Spanish people in the pharmacy. So yeah, you're not the only one, Mike.
Yeah, great. I didn't have to pay very much for my all of the chemo medication. In fact, I didn't pay anything for the chemo medication because I get that at the hospital. That's all free, but the prescription stuff, which is all of the anti-nausea tablets and that, they didn't cost me very much at all. And they gave me enough for the whole series of 5 cycles over many months. So I mean that was 20 something euros, I think 30 maximum, that I paid for all of those, and that was quite a large bag full. So there you go. And El Davido says I was paying about 27 euros a month once I received my S1. I now pay about €2.34. There you go. So yes, it's cheap. That's good to know. I know when I was over in living in County Kerry in Ireland, a friend of mine was getting his heart medication and all of his other medications. He was paying over €200 a month for all of his medications, wow, which was just ridiculous. And he was nearly 80. Yeah. It's not like he was given any discount for being ancient.
Wow.
And Aideen says we purchased medication as we had not brought enough with us. They were a fraction of the price than in the UK. Yeah, so even if you're not on prescription, you can get good cheap prices at the pharmacy. And the pharmacy staff are all highly trained as well. They can give you medical advice on the things that you don't necessarily need to go to the doctor for.
Yeah,
There you
that's
go.
great to know. Thanks for that, Aidan. You know, people will have different their own experience, which is nice. They have that kind of first-hand experience, so I really appreciate that information. It's helpful for the other people
Yes.
that may be thinking of moving to Spain, just to know that they're very cheap in comparison anyway.
Yes, indeed. So, what does a healthcare policy cover? For example, is dental included?
Yeah, so that's a good question. So, for example, I could speak about air health insurance policies. So, they're full coverage. So, that's hospitalizations, emergencies, inpatient and outpatient surgeries, and GP visits, primary care physicians. So, just visiting a doctor covered. Then, specialist as well, such as a dermatologist, traumatologist, psychiatrist, psychologist, physiotherapist. So, specialties, general doctor, hospitalization, surgeries, emergencies. And then regarding dental as well, with their policy, kind of like basic dental coverage, which is kind of typical in Spain. So if you want to have a checkup or any appointment, that's covered. Simple extractions, and then you get an annual dental clean as well. So that dental coverage is included in the health insurance policy as well. And air policy as well, just which is kind of a common question, covers you worldwide except for your home country in emergencies as well. So if you're from the UK and you have Spanish private health insurance, if you're visiting France or Germany or the US, you're covered in emergencies as well. So that's a common question as well.
Great. And last time you were on, you told us about an insurance card. Is that like a medical card, or is it something you still do?
Yeah. So you have access to a virtual and digital card. So through the insurance company, the application or the online version, you have access to a virtual card. And then you also have a physical card, which looks like a driver's license. And the physical card or the virtual digital card, you use this with your ID when visiting an appointment or hospital, and you're covered as well. So you have access through the app, and then you'll also have a physical card as well.
That's good to know. How many days does it take for that to arrive?
Yeah, typically we'll have the because a lot of people won't have a Spanish address or a full address until they move to Spain. So once you move to Spain and your card's ready, we'll have it posted to you, and it takes around within 2 weeks you'll have your physical card. But while waiting, you can use the virtual or the digital card as well. That's no issue.
Ah, that was going to be my next question. Is there a digital version of it? So yes, and
Yeah.
and you get access to that from the paperwork or immediately, is it?
Yeah. Once your policy starts, because typically people will purchase the policy a couple of months before the start date, and then once your policy starts, we'll send you the digital card, and then you'll have access to the virtual card as well. So that's how
Brilliant.
it works.
Now, an important thing I've heard is that different health centres and doctors use different insurance companies. So it's a very, very good idea when you're looking at where you're going to live and what health insurance you're getting. Make sure you get the one where there's a local health centre where you're actually covered by that particular health insurance policy. So how can people make sure that they're moving to a place where they can reach the right health centre or hospital easily? Have you got lists for the whole of Spain for that?
Yeah, well, that's also really important. So, typically the bigger hospitals in Spain, there's hospital networks, such as maybe people would have heard of them, like Quir and Salud, HM hospitals or Vitas. They're really popular hospital chains, based in typically the bigger cities, so Madrid, Barcelona, Valencia, Malaga, and they typically work with a wide range of health insurance companies, and then maybe smaller doctors, clinics, or centres will work with different health insurance companies. So, as you mentioned, it's really important to ensure where you'll be based, whether it's in a city, in a smaller town, that you have hospital centres, clinics close to you that are within the health insurance company's medical network. So there's centres or clinics in your area that you can visit, and you'll be covered with your health insurance company. So really important to check that, and we can also assist with that as well. With our policies, we have and typically other health insurance companies as well. They'll have lists of, for example, in Barcelona, in Almeria, in Valencia, we'll have a list of the hospitals, dental clinics, centres that you can visit, and we can always help with that. But always really important to ensure that where you'll be living, you have access to centres and clinics. With our policies, the medical networks are very, very wide, and a lot of hospital centres and clinics to visit as well. So that's a really important one.
Yes, indeed. Anton Kez is saying, oh, by the way, we like the new moving tagline thingy at the bottom of the screen. Yeah, me too. I've been able to do this all the time, but just for some reason, I've not got around to using them. But if you like them, you'll love these ones. Look at that. Woohoo! I can do all kinds of things. You can do the buy me a coffee one, and you can even try smart currency exchange, whom I highly recommend for your currency exchange. And if you get the free account and free advice from them, here's a quick plug, then you're helping YouTooSpain out. So do that one there. You can find all of these links and QR codes and everything in the video description below. It's one of the first lines after you contact details for Ciaran is a SuperLink that if you click on that, takes you to all the information you need about YouTooSpain, and also about my music as well, and all of the different ways that you can donate. There you go. That is handy to know. And Jed Tierney is asking, for those who've moved to Spain but visit the UK, would the private insurance cover them when in the UK?
Yeah, really good question. Again, Jed, unfortunately, with air insurance, which I believe from my experiences is quite typical, your Spanish private health insurance, it won't cover you in your home country. So if you're from the UK, or if you're from Ireland, when you're back in your home country, you don't have coverage, unfortunately. But in other countries, if you're traveling, you're covered in emergencies. So to answer your question, unfortunately, you wouldn't be covered if you're from the UK.
Yes, unless you're a pensioner and you've got your S1.
Yeah.
Then that's all very handy. That's actually, do you know about the what's it called in Ireland? Is that the same as the S1 and the whatever it's called in Ireland? Does that have the same kind of coverage?
As far as I'm aware, it doesn't. I don't know too much about that, if that's applicable. I haven't heard of it. It may, so I don't want to rule it out, but I don't think there's something similar to the S1 for people coming from Ireland. Well, I could be wrong.
I think there may well be. It's according to somebody who messaged me on Facebook and was going to be listening in on the show. If you're listening in, tell us all about that. I think it is called the S something, but
okay.
Yes, but obviously, if you've, I was wondering whether I could get it on. I'm not retired yet, but I presume as I did pay into the UK's system, then I'll be able to get the S1 once I'm retired. I'm getting free healthcare anyway because I'm self-employed. But yeah, at some point I might stop doing this. I don't know. I might just carry on going until I fall asleep at the desk. There you go. So, when you see a doctor at the local hospital, would you pay for the medical expenses in advance, then claim it back, or is it all done through the insurance company?
Yeah. So, excuse me. Once you visit a doctor, hospital, clinic within the medical network, you just show them your ID and your insurance card, and you're covered. No payment, no claims. We'll take care of that, and you just visit the doctor, show your insurance card and your ID, and you'll be seen, and no payment involved. We take care of that. So that's an important question as well, and important to know.
Excellent. And this one I think we may have already covered, but what about prescriptions? Are they covered?
Yeah. Unfortunately, prescriptions or medications aren't covered. They must be paid for out of pocket, but I believe as some viewers have commented they are quite cheap, because people do ask about the prices as well, so they're not covered unfortunately.
Mhm. There we go. Yeah. Is there some kind of visa insurance, and who can buy that?
Yeah, so the health insurance we offer is visa insurance. So of course there's many different types of health insurance, but for coming to Spain on a visa or on a residency permit, the health insurance, it must meet the visa requirements. So typically visa insurance, like air insurance, will have no co-payments, full coverage, no coverage limit, no deductibles, include repatriation. So visa insurance is the health insurance you need when coming to Spain on a visa or a residency permit.
Ah, see, I was wondering about that question. Because it was a question that you gave me 2 years ago to ask you, and I thought it meant insuring against your visa not working or something like that. Thought that's an unusual
No.
question, but yeah. Now I understand why I asked that one. There we go.
Yeah.
Do you need an address in Spain? This is something that you don't need for your visa, but you need for your residency. But do you need a Spanish address to get the insurance?
No, so when you're purchasing the insurance, which is really important as well, because some people may have property or an address sorted. When purchasing the insurance, we don't require a Spanish address. You don't need to give us any address. You can just purchase the insurance, and the only time we'll ask for your Spanish address is to post your insurance card to you. So no need for a Spanish address.
Right. And what about a Spanish bank account?
Yeah, so same again, no need for a Spanish bank account. You can pay you can pay with a Spanish bank account, you can pay with a bank account from the UK, from Germany, from Australia. Any bank account is accepted, and you can purchase it 100% online as well.
Great. Now that's all the questions I've got written down, and I think that covers most of the things you need to know. Are there any more questions on the live chat? If you do have those, then get typing now. There is a 20-second delay or so. So while we're waiting for that, is there anything else that we've not said, Ciaran, that might be helpful to our viewers?
I think we covered out everything. I'd be very welcome for any other questions people may have. I'd be happy to help. So hopefully we get some more questions in, so we can hopefully help the viewers. And also, which typically when I'm speaking to clients, they'll have some questions, and then they may have forgotten one or two. So if anyone has any questions that they may come up to them this evening or tomorrow, any questions, just reach out to me via our website, via email. I'm available via telephone as well. So if anyone has any questions that may appear after, I'd be happy to help.
Great stuff. Actually, I've not got your telephone number in the video description. Maybe you can send that to me afterwards. I've probably got it somewhere, but
Yeah.
send it to me anyway. And,
Yeah, I'll send that afterwards.
Yeah, and you can also ask questions, everybody, in the comments below after the video has just come out. After the live show has gone off the air. Yes, this video will be available forever on YouTube. So. Yes, you can still ask questions on there, and I will pass them on. There you go. Oh, yes. We have a question from Jed. Travel insurance usually offers joint policies. Can you get joint health insurance?
Are you referring to, for example, a couple?
I think he is.
Yeah. Sorry if I have that mistaken, Jed. But you can apply as a family or as a couple. You can both apply together and purchase together. Although you'll have a policy each. We don't have like a family plan or a couple plan when you're both on one policy. But you can purchase together, and you will be on the health insurance company system together. But you'll have a policy and an insurance card each. So that's how that works. Hopefully that answered your question, Jed.
Yeah, so it sounds more like a sort of a linked policy.
Yeah, exactly, yeah.
Yeah, brilliant. And Aideen is saying, thank you very much. It was very helpful. Yes, indeed. It has been very helpful today. It has been a wonderful show. And that is about all we've got time for this week. We've managed to almost squeeze it into an hour. And make sure you click on the like button if you haven't already, and subscribe, and click on that bell for notifications. And I'll tell you in a moment who your special guest will be next week. But first, let's give Ciaran a big virtual kiss and a hug and say goodbye for now. I'm sure we'll have you back on the show it'll be less than 2 years before we see you again.
Hopefully.
I'm
See you again
sure.
soon.
Yeah, it's been an absolute pleasure.
Thanks very much, Skatz, and thanks to all the viewers for contributing as well with the questions and the insights. I really appreciate it, and thanks for having me on. I hope everyone has a lovely Saturday.
Excellent, you're very welcome. So, bye-bye for now.
Goodbye. Bye-bye.
Well, what a lovely show it's been. And so, in answer to the question, who do I have on next week? I'm sure most of you know. Every fortnight we have Chris from Upsticks with regular answers to all of your questions. So we have a special feature usually to start the show, and I'm not even sure what that is yet. Chris and I are going to be discussing it over the weekend. And Chris is actually on holiday over the coming week, and also I have my chemo treatment coming up on Thursday, so if my blood test results work. So I think we're going to be pre-recording the show on Tuesday of this coming week, so we'll have to decide very quickly what we're going to be doing on the show, but it'll be something very relevant to all of you, I'm sure. And of course we'll be debating something important or hilarious or both as our usual argument at the end. And we also do frequently asked questions, and we usually do an Ask Us Anything if it's a live show, but obviously we can't do that on a pre-recorded show. But you can ask questions in advance on the Facebook page, so if you do that before Tuesday, then I'll make sure we answer those questions on the recording. And you will still be able to do the live chat with each other as the video comes out on the Saturday, because it's done as like a not a preview, there's a special name for it, where it kind of goes out live even though it's a recording. So yeah, I might even watch the show myself depending on how I'm feeling on that Saturday morning. Anyway, thanks to all of you for joining us and leaving comments, hitting the like button and supporting us with donations and comments and memberships and everything. All of you are saying thank you very much, and FOF and thank yous, and Jed says he's still in the Oasis ticket queue. Very good. And Anton Cares gives the usual FOF, peas and fluff, bon weekend, y'all, BG, staying alive, glory again, or I will survive. Ta-ta for now, Anton Cares. That's lovely. I'm glad that's there every week. There we go. There it is. Thank you so much, guys. You've been a big support. And yeah, it's been very much appreciated, all of you joining us. I'll see you either on the midweek video or on the live Saturday morning show at the regular time of 9 o'clock if you're in the UK or Ireland or Portugal, anywhere in that time zone, the Canaries as well, I think, or 10 a.m. if you're in Spain or Central Europe. That's all for this week. Somebody pass around the healthcare cookies. Peace and love, peas and fluff. And here's one final message from all of us and all of the voices in my head here at YouTooSpain. We'll see you soon.
Goodbye, toodaloo, peace and love, peas and fluff, oi oi, don't do anything I wouldn't do.
One more cosmic dance?
All right then, look mum, I'm dancing, oh, I'm all a quiver, let's dance.